Hey everyone, Dr. Jason West with the Thursday night live cast, the 5 things that you can do to help to be healthy, and some really neat things that we get to show with you where it's not just me saying it, it's actually how we're helping people inside of the office. And then just a recap of some different things. So one, a Fox News segment about this little bug from China, and then there's a new company out there saying that they have virus-proof clothing, or clothing that helps to do with maintaining your immune system and preventing the virus coming in. And of course, Fox was saying, "Hey, Dr. West, what do you think about that?" And I said, "Well, maybe if you are looking good, and it's going to help your immune system." And I have nothing against the clothing company. It was just a fascinating thing how they're taking silver strips and colloidal silver and they're embedding it in the clothes, and they think it's really going to help with the virus. It's going to be really interesting of how that pans out. So you can see that on our YouTube channel and also on our Facebook live feed. We just did that yesterday. And then as everybody is talking about what's going to happen with school opening up and the different universities, everybody wants to know, well, what are you doing to maintain your health? And so what I tell everybody, again, it's the basics. Like, in a shout out to my friend Margaret that's in Midwest in Nebraska, who basically had some problems, got into the hospital system, and she was able to get her health back. Big celebration and a shout out to the hospital in Nebraska. So Margaret's been a longtime follower, and not only was she doing everything in medicine, she was doing everything that we could do to help with your immune system, and the positive outcome is that she's better. So she had the dry cough, she had the fever, and she thought, oh my gosh, I'm going into the system, and guess what, she's home. So big shout out to Margaret. And here's the protocol that we recommend. You know, vitamin C, 3,000 to 5,000 milligrams. Vitamin D, about 10,000 milligrams. Vitamin A, 10,000 international units. And zinc, about 30 milligrams. There's some really neat places you can get it. If you need some help, please put that in the comment section. And one of the things that we're really appreciative of Dixie and of Wendy and of Cupcake Paper is when they like and share the videos, because it helps us to get the message of hope out to everybody. And so I hope you guys will consider doing that. Please like and share the video. And now let's talk about the things that you can do to help. So one of my favorite stories is coming up. I got 2 awesome stories that we're going to share just in a minute of people that are inside of the office that we're helping. One with migraine headaches, which is such a debilitating problem, and it's so, like, there's so many more tools than just giving a prescriptive medication for migraines, or just getting into a dark room and putting a rag over your head and waiting for that to pass. And you're going to hear that in just a minute. It's getting everything lined up as far as biomechanics. So some upper cervical adjustment work is a really good place to start. Also making sure that you're regulating blood sugar. Now, one of the words that my dad drilled into me when I started practice with him in 2020 and is to make sure that we get really healthy stuff into the body. And just one second. I need you. Thank you. I couldn't concentrate for a second. So we got to get healthy stuff into the body to make sure that we have everything lined up. So you want blood sugar, and the thing that my dad always drilled into me was something called neuroglycopenia. And what that means is when the blood sugar drops, the nerves fail. And so many headaches and emotions and anxiety are related to blood sugar. Matter of fact, for those people out there that are struggling with insomnia, one of the suggestions I have is get some protein before you go to bed. So some beef jerky or some cottage cheese or something that's going to give you some complex carbohydrates. I know there's some people out there that are always asking me about potatoes, and I think the way that you make potatoes is really important. But a baked potato has some really neat things in it for health, and it really helps people to sleep all the way through the night. And by the way, a big shout out to Andy and Chris Dayro, my friends from the Bahamas that were here with me. You saw Andy's story of beating an autoimmune disorder called pemphigus vulgaris, which is, we have another patient that we're doing the same thing and getting the same outcomes. And what we're doing is we're hyper-oxygenating the area. So we've literally taken a shower cap and we've kind of like put it over his head, and then we put a little tube of oxygen ozone in there, and guess what? It's going away. Just like Andy's story. So Andy and Chris, I hope you guys had a safe trip back. Some really neat things to tell people as far as getting the body balanced. I'm going to share with you my favorite therapy. And what it is it's called micronutrient therapy. You're going to see it in just a minute. And what it is how we can skip the stomach and we can help heal the body from the inside out. Now, that's kind of a little bit of conflict of what a lot of times we say in the office, because we say, well, you are what you eat. And if you get good stuff in your system, then you heal. But what you have to remember is sometimes people have such a diseased or problematic stomach that you can't push nutrients through it very well. So malabsorption syndrome, irritable bowel syndrome, and then when you get to the later part of the colon, you have ulcerative colitis, and you can get Crohn's disease. Matter of fact, we have another great story about Crohn's disease that's coming up here. But what you got to do is you can skip the stomach and go right into the vascular system, and we can call that nutrient infusion therapy. And here's the benefit. When you take things like vitamin C and magnesium and B5 and B6 and zinc and folic acid, and you put it into the bloodstream, what happens is you can create a concentration gradient of those nutrients, and then what happens is it goes in and it delivers the payload to the organs, tissues, and cells. And so I did a little video about this that we do for patient education. It's called IV micronutrient therapy. And my producer, Caden, if you can get that teed up, let's show everybody this video. We're ready to go. So guys, check this out. One of the most important things you can learn about for chronic health conditions. Hello everyone, Dr. Jason West, and I'm excited to share with you a treatment called vitamin infusion therapy. It's a way to really correct chronic health diseases quickly. We started in 1916. I know I look way younger than how old that is, and all joking aside, it was started by my great-grandfather and my grandfather and my dad. And back in 2000, my dad got really, really ill. His liver enzymes went off the charts, his joints basically wouldn't work, his eyes swelled shut, a lot of bowel problems, and we didn't find out till later that he actually bit down on a nut, and he had a crown on his tooth. He had a mercury filling or a mercury post underneath it. He got some of the mercury into his GI system, and he did not function very well. It was horrible. We were taken around to all of these different specialists, and the specialists work really hard on trying to help us understand, but no one gave us any answers. And I was at a medical conference in Kansas City, Missouri, and a doctor there said, "Hey, Dr. West, your dad has scurvy." And I said, "No, scurvy was solved 100 years ago, hundreds of years ago by Dr. Lind, and it was all about taking limes and lemons and oranges and stuff like that and getting it into the diet of sailors so that they didn't have the joint pain and the ligament problems and their teeth falling out and bruising and stuff like that." And sure enough, those were my dad's conditions. We actually got a lot of help from a Dr. Taylor in Tulsa, Oklahoma, and he told us how to do these vitamin C infusion treatments, and overnight they took my dad from death's door to really good health. And so we started doing them here, and I have absolutely fallen in love with a way to absolutely turn around fibromyalgia, chronic fatigue syndrome, Lyme disease, multiple sclerosis, peripheral neuropathy. There's a protocol for macular degeneration. These conditions that usually don't get a lot of medical help. If you skip the stomach and go right into the bloodstream with vitamin C and B5, B6, B12, magnesium, potassium, all natural things, and increase the concentration gradient so you can actually get way higher concentrations of vitamins. You go through the intravenous route than through the oral route, and you can make changes. A lot of times people will say, "Why can't I just take the oral therapy or oral route?" And the answer is, by the time people get to our office, they're out of hope, they're out of options, they've tried a lot of things. This is usually the most reasonable route to make changes. Your lifestyle is absolutely key, your diet is key, but one of the neatest things about these protocols is the vitamin C application. You can probably write a book about what vitamin C doesn't do. It would be easier than to write a book about what vitamin C does, because it does everything. And it's probably my favorite vitamin. Vitamin D3 is right behind it, but vitamin C is so amazing because it's the most powerful electron donor in nature. And what I tell people is vitamin C is kind of like a bank. If you have more electrons or more money going into your bank, you're healthy. If you have more withdrawals, then what happens is you go into debt, and your body will go to different organs and tissues and steal the vitamins and minerals from those tissues to run things. So you rob Peter to pay Paul. And so really, when people have a chronic fatigue issue or a fibromyalgia issue, what is happening is they're out of energy. And vitamin C infusions help to give your your energy. It helps to turn on your immune system, so it's really effective for chronic infections. We've saved multiple legs and a hand from amputation. We've turned around conditions that were not responding to IV antibiotics or hyperbaric oxygen chamber therapy because of the vitamin C. So you're donating electrons to the body, you add the mineral component, and you can get some amazing turnarounds. Another IV application that's really powerful is to do something called dimethyl sulfur oxide therapy, or DMSO therapy, essentially refined tree sap. It's a universal softener. It does make you smell like garlic, but it is so effective for circulatory conditions, especially stroke recovery and cardiovascular conditions. There's also the ability to do some refined hydrogen peroxide therapy, where you take 1 cc of hydrogen peroxide, you add it to 100 cc's of a saline or 5% dextrose solution, and it's like putting Alka-Seltzer in your system. It's not harmful. We've done thousands and thousands of treatments with hydrogen peroxide, but it gets extra oxygen in your system. And then something to get rid of toxins and to flush the lymph nodes is dilute hydrochloric acid therapy, where you take 1 cc of hydrochloric acid and add it to 500 cc's of sterile water. You put it into infusion, and it has amazing ion changes in the lymph node, which is your infectious processing center. So you can do some things with vitamin infusion therapy that are just not possible using the oral therapy route. And when you get people to change their lifestyle, you have self-communication, get some movement into their system, and use the IV vitamin infusion pathways, now we don't hope for miracles, we actually expect. So how we do vitamin infusion therapy is we take some saline or electrolyte solution or sometimes sterile water, and if you add enough vitamins into the solution of sterile water, you can actually get it to be the milliosmolarity of blood, which means that you can get the blood and the vitamin solutions basically to equally other out. You put it into a little container, it's gravity fed. You take a little catheter, you stick it into the vein, and what happens is you start infiltrating everywhere where blood goes to with this amazing vitamin solution. You can increase the concentration gradient, which means you can get really high dose vitamins in there, and actually we can push it into the organs, into the tissues. It helps to turn on the immune system. Usually the treatments take about 2 to 3 hours to do. When people are really sick, the initial couple treatments, they'll feel a little bit more fatigued or tired because you're actually flushing all of those toxins. When you're feeling pretty healthy or have been doing them for a while, I always tell people it feels like I'm getting a burst of controlled energy. I feel like I can walk through walls and bullets can bounce off me, and I can learn Greek or calculus because it really helps with the vitamin solutions to your nervous tissue and to your brain.
Okay, so here's the cool application of this, is you're going to see it in just a second when we talk about the advanced application of nutrients. And it's such a cool thing to do because you're going to see some of the amazing outcomes. So you're going to meet Diana in just a second. We're going to talk about migraines and vestibular migraines and how we literally went away. She was totally non-functional, and now she's functional. And then you're also going to meet Penny, who literally came in with ulcerations from her throat all the way down. And medically they said, we don't even know what to do for you. And we helped both of them with this micronutrient infusion therapy. And then I just wanted to give some shout outs to people like Sharon Gould, she's always here, hello, and also Teresa Fogelman, my friend over from Magic Valley area, and then Rob and Julie Harmon, I wanted to say hi. I mean, there's so many people. And then of course Shirley Clark. Like Shirley, we should probably get you on here sometime and tell your story, because it's awesome. And then also your son's story is really cool. But let's talk about the vitamin infusion therapy, because there's some really important building blocks to learn. And one of the reasons about that is because we take this awesome building block system of vitamin C, and a lot of people have misconceptions about vitamin C. So I just want to tell you what's in these micronutrient infusions. Vitamin C does a ton of different things for your immune system, for your connective tissue, for hormone function, but what it really does is vitamin C is the best way to donate electrons to the body. And so many times people will come into the office, they'll go into the healthcare system, and they're exhausted, and they're fatigued. And you know what, this isn't a recognized medical diagnosis, but it's just accurate. And maybe some of this people will really resonate with this, is the reason why people get sick is because they run out of energy. And then when they run out of energy, they start looking for a crutch of chocolate or sugar or alcohol or prescription drugs or recreational drugs. And guess what? It doesn't stop there. It's stress, it's trauma. You know, I have patients, and I may have a family member that I need to gently tease about this, that she doesn't have enough stuff to worry about. Like, she'll make up stuff to worry about. And the reason why she does that is because that creates adrenaline and epinephrine in the body,
and it literally gives them a little bit of a jolt. So they'll be like, hey, well, we really can't control what's happening on the world stage. If we get caught up in that, what happens is we can get really stressed and worried about it. It kind of temporarily makes us feel a little bit better because we manufacture adrenaline over here. But the long-term problems with that is it decreases adrenal function and it exhausts people. And then they're looking for something. And then all of a sudden sugar comes into play and carbs come into play and soda pop and different things that really aren't healthy. I mean, if anybody's listening and we're talking, please listen to me. Like, if you want to get anything better in your life, anything, one of the first things I encourage people to do is to stop drinking acid. And people say, I don't drink acid. Well, how do you think carbonation gets its fizz? It's carbonic acid. So whether it's seltzer water or whether it's clear, if it's Sprite or Dr. Pepper or Pepsi or Jolt or energy drinks or whatever it is, like, it comes with the price tag. And unfortunately, the price tag's down the road just a little bit. The other thing that's really neat in the vitamin infusion therapy is B5. It's called dexpanthenol. It's one of the best feel-good vitamins out there. And the reason why is because it helps to generate energy in a secondary mechanism, because it helps convert stored energy, also known as adipose tissue, also known as fat, to energy. So B5 is one of those things that's really neat to tap into your reserves. B6 is a natural anti-inflammatory. B12 is wonderful for your nerves. And then the miracle mineral of magnesium, it's a coenzyme for 300 enzymatic reactions in the body. It has to be balanced with calcium and phosphorus and potassium. But we put all of that into a bag, and when you give it to people, you get amazing outcomes. So in a second, I'm just going to introduce you to Diane. Diane came in non-functional with vestibular migraines, with upset stomach, like she was non-functional. And then I told her, do you believe your diagnosis? Like, this is so important. And she's like, no, I don't. I think there's something else out there for me. And I said, I don't believe it either. There's a person in there. Here's Diane's story. Check it out. Everyone, it's Dr. West and Diana just sharing a neat story of hope and healing and health. It's just great. We did a 3-month follow-up with Diana today, and she told me some really neat things about being able to do stuff that you couldn't do before. So you got to tell everybody what it was. So first of all, let's talk about being able to work.
Yeah, so before, when I would work, I used to come home and have to take a nap before bedtime, and I wasn't able to function. I wasn't able to fix dinner for my kids, and just within the last 3 weeks, I worked 2 days in a row and came home and didn't need a nap and was able to just fulfill my duties as a mom and a wife and individually for myself.
And that's such a neat feeling on my side when someone comes in and says, hey, I'm normal.
Yeah.
And I asked her how my normal is, and she's like 90% normal. So, and then the other thing is tell them about the skiing, because that was really cool too.
Yeah. So I was able to ski a full day with my family, and it was so fun. And I just remember I came home and cried because I was so happy that I was able to do that.
So Diana, how did you feel before you came into the office? Like, how were you functioning?
So I wasn't functioning. I would wake up 2 hours later, take a 3, 4, sometimes 5-hour nap, and then just lots of Diet Coke to get through my days, and it just was a repeat, and just not functioning.
Was there a medical diagnosis before you came to see the West Clinic?
I did get diagnosed with vestibular migraines, and so those were kind of debilitating. I did have a stretch of my life where I went 4 full months without being able to drive, and we live out in the boonies, and that really put a damper on my life because I had to call and ask people to drive me places and my kids places.
And then when we started treatment, the migraine stopped.
Yeah, completely. I did not have a single migraine during any of the treatment.
And then what was really fun is the treatments that you responded to. Like, what treatments did we do in the office?
So we did IV vitamins, and
vitamin infusions. And
then we also did neural, and neural was my favorite, and actually my favorite was the Crown of Thrones. I felt so good after that.
So what she's talking about is this is the nerve reset therapy with chronic healthcare conditions where you get the nerves to open, close, and reset. Because sometimes your nervous system develops a memory and thinks that's normal. So she was living down here with vestibular migraines. We did the nerve reset therapy, and all of a sudden she started to become normal. The neural therapy, it's fascinating you say that it's your favorite because it feels like little bee stings. It's not the most comfortable treatment, but when you see outcomes like this, people get excited to get the treatment. So someone comes in, vestibular migraines. They started when she was in high school. We started the treatments. They've gone away. We've done a 3-month follow-up. She's remarkably better. She can work days in a row. She can go skiing. She can do the stuff that she wants to do as a mom and a wife. It's just an amazing story. Diana, is it okay if I share this with other people?
Yeah.
All right, so Diana and Dr. West at the West Clinic with a story of hope, healing, and you are not your diagnosis. There's treatment options that just because you haven't heard about them doesn't mean they don't work. And Diana's a perfect case. We'll see you guys on the next video.
Okay, so I love stories like Diana. We're over 1,000 of those different stories of people that were out of hope and out of time and out of the options. And so many times people say, okay, well, what's the magic formula with the magic? And so let me tell you what the magic formula is, which I have to give you a couple shout outs. One, Kathy McDevitt, hello. And then my friend all the way from Chicago, Barbara Bach. I can't wait to see you back in September. She makes the journey from Illinois all the way out to Idaho. And anyway, we just love having you. So many fun people that we get to work with. Like, it's just great when you take the building blocks of health and you put it into people. And so here's the 5 steps of getting your life back. And it doesn't matter if it's an acute or if it's chronic. This really gives your body a foundation. Because remember, when people come into the office, whether it's a shoulder problem or a stomach problem or chronic constipation or diarrhea or brain fog or Lyme disease or peripheral neuropathy, basically the recipe is the same. Like, we want to get order back in your system because so many times people, I've lost control, like I have an impending sense of doom. We had another patient that we just started with that came over from Boise that's saying, like, I'm out of control, like I'm going to be in a wheelchair. And he's like, do you think it's because I'm old? And I said, well, how old are you? And he's, 54. Well, that's not old. Like, it used to be old. Like, when I was younger, 54 used to be old, but I'm almost to 54, and I'm not old. So therefore, we want to make sure that you get order in your system. So here are the 5 steps, and they're so underrated. Number 1, the best that you can, get your body on a schedule. Go to bed at the same time. Get up at the same time. Exercise, move. And basically get it all on a schedule. And if you don't think it's important, you should check out Lily's story that we did last week, or maybe it was the week before, where we took someone that had been sick their entire life. She's 21 years old. They got put on an antidepressant at 8, and basically no one said, well, guess what? Like, it's really important for you to drive the bus and to be healthy. So Lily's story about being order. That's the first thing. The second thing. A shout out to one of my mentors. I've never met him, just an amazing story. Dr. Batmanjidi, who's an Iranian medical doctor that basically got thrown into prison when the Shah of Iran was ousted and Ayatollah Khomeini came in. And he wrote a book called Your Body's Many Cries for Water and Water the Miracle. And you're not tired. Excuse me, I almost said you're not tired, you're toxic. That was a different author. But what he said was, here's all the things that you can help with water. Blood pressure, diabetes, arthritis, anxiety, and depression. And so many people don't get enough water. So get your body on a schedule. Then water. And when people say, how much should I drink? It's like a lot. Somewhere, I think above 60 ounces is a good place to start. Closer to 100 is really, really good. I don't think you need to be more than a gallon a day. Again, it's a little bit symptom and condition specific. Body on a schedule, get water. Then the next one is healthy and alive foods. And I love the statement that my dad taught me that said, if you are what you eat, are you fast, cheap, and easy? And so many times people are like, hey, I'm just grabbing the most convenient thing. I had a patient that I've been working with for 14 years. I haven't seen him for probably 6 or 7 years. Don came into the office, and I said, how are you taking care of yourself? And he put his head down like this. He's like, not very well. You know exactly what to do, and part of it is we just need a nudge. but you should avoid things prefabricated, pre-synthetic, pre-digested. Like if you can eat what you're eating 100 years ago, like that's a really good place to start. Another rule to follow is the rainbow rule. When you look down to eat, you should have some red, some green, some yellow, some orange on your plate, and it needs to be plant-based materials. It shouldn't be Skittles, Starburst, M&Ms, a TV dinner, a deep-fried Twinkie, or any of the other kind of funny stuff that I hear. So body on a schedule, water, healthy and alive foods, and then this is so important, you gotta have a stress outlet. And people say, well, Dr. West, what's the best stress outlet? And the answer is like, I don't know. But here's some examples. A stress outlet is stuff that you do to get grounded or basically to put a release valve in your system. So I've heard things like, hey, you should garden, you should walk, you should journal, you should pray, you should meditate, you should play music, you should listen to music, you should read, you should think, you should talk to yourself. You should have sexual relations. You should have fulfilling relationship conversations. Like there's all of these things, and whatever it is for you that you line up, now you got to take control of that, and you got to put it on a schedule, and you say, you know what, from 3 o'clock to 3:15 every day, like that's my time. Or from 7 to 7:15, or 7 to 30, or from 9 p.m. to 10 p.m., like that is my time to decompress and to visit with my family, or to talk to my spouse, or to watch my favorite TV show. Although I have to tell you, probably not TV is the best thing I'd recommend because it stimulates your brain waves the least amount. And here's what I mean by that. Like, you know, it takes less energy to watch TV than it does to do nothing. Like, if you really want to zone out, like, just put something on the TV. And so, like, that's not a good example. But schedule time for you for your stress outlet. And then the next thing is you want to make sure that you have some food insurance. Now, food insurance is also known as supplements. Supplements are meant to fill the gap in for a healthy diet. And so many people will say, okay, well, Dr. West, tell me what you're taking. I'm like, okay, well, just so you know, like I'm a little bit of a closet hypochondriac because I read about things and I don't want to have experienced those. Like I really want to skip prostate problems. I want to skip heart disease. I want to skip diabetes. I really, really want to skip dementia and brain fog. And so I read about things and I'm like, well, I need some glycerol phosphatidylcholine for my brain. I need some niacin, a red rice yeast for my liver, my heart management. I need some saw palmetto, and I need some vitamin T and bioflavonoids for my prostate. I want to make sure I have a healthy stomach. I want to make sure I have healthy blood, so I have chlorophyll. So in my book, I have a listing, and you can get this book at drwest.info if you want it. I think it's chapter 23. It lists everything that I take. And of course, it's a little bit dynamic. I take vitamin D3, and I try and eat as healthy as possible and get my body on a schedule because we're all dying. You just want to die as slow and as healthy as possible. So with that being in mind, I'm excited to introduce you to Penny. Penny came into my office from a town, not my town, a town far away, and she had throat ulcers. And I said to him, well, what are they doing to fix it? And she's like, well, they're giving me antacids and they've been giving me, you know, some pain relievers and stuff, but I can't function. And I said, well, I know what we should do. Like, let's skip your GI system, which starts in your mouth and ends at the exit of your body. Like, let's just skip the whole thing. And let's take some vitamin C, which gives you electrons. Let's give you magnesium, which makes your enzymes work. Let's give you vitamin B5, which converts fat to energy, and vitamin B6, which is a natural anti-inflammatory, and zinc, which is really important for wound healing and epithelial lining. Let's skip that, put it right into your vascular system. And here's Penny's story. Check it out.
A lot of things have been ailing me. I got sick with pneumonia before I came into Dr. West. And my blood, I lost all the nutrients in my blood and things like that, so I couldn't walk, and I couldn't eat solid foods. And the first time I came in, my son had to carry me in. But Dr. West has done wonders with my blood and got it all back up, and I can walk now, and I exercise now, and I can do all sorts of things.
What were you diagnosed with?
Well, in the first place, I was diagnosed with my esophagus was twisted shut, so I couldn't get food down. And they finally figured that out after 2 years of me just eating liquid food and straightened that out. But by that time, then my blood and everything was a mess, and I had no antibodies or anything in my blood or anything. And my sister told me about Dr. West, and here I am, and got another chance at it. So.
And so did Jason diagnose you with anything?
The blood problems. He went through my blood and figured out that I didn't have enough oxygen going through my blood, and that my cells were way too big, and he helped me with the pain, and he found out that I had gout, and that was causing a lot of my pain, and Ken treated me for that, and I can't remember what else. I've been here for a long time, so he's diagnosed me with quite a few things. I am back. I keep coming in and getting some IVs to keep my blood up and stuff, but I'm back to normal on everything. My blood's up. Activity-wise, I can move around. I don't fall on my face when I get up anymore. And everything's pretty good, except for I have arthritis and my joints hurt. But I'm exercising and taking water aerobics and things like that to build my muscles back up. But all because he helped me build myself back up.
Yeah, and the joint pain.
Oh, I love these people. Dr. J's wonderful. He's not only his treatments, but he makes you feel like you can get better. The emotional. Builds you up emotionally so that you can actually feel like you can do it. And it's like family here, you know.
All right, so those stories, they're just fun. And you know, I'll keep referencing my dad. My dad was in practice for 51 years, and he taught me so many lessons. He passed away in 2011, and one of the things that he told me is Jason, you're gonna have the opportunity to work with people at an intimate level in getting their health back, and when you do that, you get friends for life. And so you get to meet some of my friends, because what is so fun about that is when you help people to get balanced, like, good things happen. And so a couple comments, you know, about that. You know, Dixie and her freedom-loving husband, Lyle, I always tease him that he's a closet communist, and of course that's not true. Really special to me, and Shirley saying, I'm glad I found you, and Teresa, and everybody that's been watching the channel. It's so fun to help people to get order back, and order in getting your body on a schedule, having healthy emotions, taking time for you, eating healthy and alive food, and then some advanced treatments like the nutrient therapy. Next week, we're gonna talk about an advanced way of getting your nerves to reset. Because so many times, just like with Diana, we talked about how she's living here, and her mind and everything, she wants to be like living up here. And it's important because the purpose of life is not to just exist. It's not to survive, it's to thrive. Like, you want to live life to the maximum potential. And health, when you don't have your health, you can't live that way. So you can't live up to your potential. You can't have as healthy as relationships. You can't have the wonderful experiences that you could if you had health. So let's put a health system into you that can really, really help. And that's all about balance. Balance your hormones, balance your biochemistry, balance your biomechanics. We can use nutrient therapy. You can use oxidative medicine. There's vitamin injection therapy. There's neural therapy. There's peripheral neural injection therapy. I mean, there's tons of things that so many people don't know about, which is the mission of the channel. The mission of the channel, you know, the most frustrating thing for working with people is not, can you help them? The most frustrating thing is, well, I wish I would have found you or a clinic like you earlier. And so that's why I'm asking people, please like and share the channel, because there's lots of doctors that do things that help to restore balance and stuff. And those are the guys that we want people to be aware of, because, again, one of my dad's statements, I can hear his voice chirping at me right now, there's no shortage of sick people. Like, if we could help everybody on one visit, it would be fantastic. So let's help to get the message out. Talked about the 5 different things to be healthy: order, water, healthy and alive foods, making sure that you get time for you, and then knowing some of these advanced integrative and alternative medicine procedures. Like, there's a really nice roadmap. I wrote it in our #1 best-selling book. drwest.info is where you can get the book. And it's something that we provide for our patients when they come in the office. Next week, we're going to talk about nerves.
And there's so many different things, like macular degeneration is a nerve problem here. Peripheral neuropathy is a nerve problem on your feet. And so many times people cannot be healthy because they don't have a healthy nerve memory. And here's what I mean by that. So many times people's nervous system accept being sick or a chronic injury or a significant emotional experience as being normal. So I'll have people come in, you know, that are in the ranching rodeo world, and I like to tease these guys because they're awesome for business, because people that have horses and that rope and stuff, like they have no off switch. Like they go out there and they get bucked off, they get, you know, torn rotator cuffs, they get pushed up against the trailer, they're lifting I mean, one of my jokes I tell people is when they said, I'm healthy now, what should I do? I'm like, you should buy a horse. Like, that's what you should do. Now, all joking aside, and why I even bring that up is because so many times someone will get a rope caught around the finger, the cow takes off and pulls their finger off, and they'll come in the office and say, Dr. West, my finger is killing me. And what's happening is it's not even there, but they've had a specific type of nerve injury, and now the nerve is telling the central nervous system in the brain, I hurt, I hurt, I hurt, I hurt. We call it phantom limb syndrome. It also is really common to occur with shingles. And so you get the shingles irritation around the chest, or sometimes up into the face, or on the leg, and then what happens is the nervous system is stuck in a painful memory. And even though the infection and the lesion is going away, it's telling the central nervous system, I hurt, I hurt, I hurt. Well, guess what? You don't have to have an infection or a limb amputation to have a chronic nerve memory for your stomach not working right, or the hormones not working right, or the heart that's always in fibrillation, or a shortness of breath. There's a lot of asthma people that can be helped by resetting the nerve supply that goes to the control of the lungs. And it's an amazing treatment developed by a medical doctor in Louisiana, Dr. Harold Philibert, called the infraspinatus respiratory reflex, or the IRR treatment. And for 20 years, I've seen amazing outcomes with asthma by treating the nervous system. It's not a steroid deficiency. Now, I'm not anything against steroids as far as opening up the airways, but when you clean up nerves, a lot of times you just don't need that puffer anymore. And so there's a lot of neat options there. That's what we're talking about next week, is nerve memory. We're bringing people, testimonials right inside of the studio. Please like and share it. If you need any more information, drwest.info. Also, we have a blog, Patients of Good Outcomes, not good outcomes, amazing outcomes of wheelchair to walking and people beating their disease. We're really helping with some amazing cancer support cases that we're going to have on in September of how you can help people to beat uncontrolled growth. And so it's a whole systematic approach that we're going to be sharing. So anyway, that is the show today. You're not your disease. There's 5 tips to be healthy. And I'll see you guys next week, Thursday, 5 o'clock Mountain Time, on our Facebook and our YouTube channel. This is Dr. Jason West signing out. I'll see you guys next week.